Um, Today's entire episode, of course, is being recorded and being streamed live on our Facebook handle, and will also be put on other social media platforms. You can always go back, visit, like, and share the video. Today we have Dr. Ahmad Abdul Wahab, who's of the Nigeria Governors Forum. He's going to be talking to us about trending issues and how it affects the states. Of course, you all know that Nigeria Governors Forum is a forum where the 36 state governors belong to. They share where, and the NGF, a lot of people do not know that the NGF actually has secretariats there. They have different issues, departments on health, security, economy, and things like that. So Dr. Ahmad Abdul Wahab is from the Directorate of Health. Are you there, doctor?
Yes, I'm there.
Yes. So we're going to start now. Let me just go straight. Nigerian doctors have been on strike now for over a month. So what is the effect of this strike on the COVID-19 response, especially in the States? It seems your mic has been muted, doctor.
Yeah, no, I think it's fine. So we're trying to make sure we don't have echo here.
Yeah, so, okay, let me say it again. Dr. Ahmad Abdul Wahab is a public health expert, and he has several years of experience locally and internationally. And he's the senior health advisor at the NGF Secretariat, that's the Nigeria Governors Forum Secretariat. He also leads the subnational coordination pillar of the PTF, that's the Presidential Task Force, now known as the Steering Committee, if I'm not mistaken, on COVID-19 response. So as I asked earlier, doctors have been on strike now for over a month. What is the effect of this strike on the COVID-19 response in the States?
Okay, thank you. Thank you, Mr. Akikyotu. I hope I pronounced your name correctly. Yeah?
Akikyotu, you got it right.
Okay, so it's a pleasure being on this roundtable discussion, and I think this kind of forum provides opportunity to actually enlighten the public on what's happening. Before I actually address your question, I think there's something you mentioned, which is what a lot of people don't know about Nigerian Governors Forum Secretariat. That the Nigerian Governors Forum, I think, is the group of the governors. But then you now have a secretariat, which is now the technical and administrative arm of the NGF. And like you said, we have different units. And what we do in the secretariat, we help shape where the technical arm of the secretariat, and it's a resource center that helps shape discussions in the NGF. So every month the NGF meets, and then the secretariat looks at important issues that needs to be brought to the attention of the governors, or maybe issues that you need to reinforce for the governor's attention. And so the secretariat brings those to the attention of the governor, and then we discuss at those meetings. So this issue that you just mentioned, the issue of strike, in fact, is two big issues affecting the health sector. One, you have the strike. The strike on its own, even without COVID-19, is a big issue on its own. And then the COVID-19, even without the strike, is also another issue. Now, having those two now combined, happening at the same time, you know the effect is really going to be really, really terrible. So it's not the whole doctors that are on strike, just to clarify, is the Nigerian Association of
Resident doctors
that are on strike. And I think these issues have been lingering for some time. And so doctors, of the pillars of the COVID-19 response, you have a lot of the pillars that doctors are particularly responsible for. For instance, when you talk about case management, for cases that are very, that requires hospitalization, then you have doctors, nurses, the health team working together to manage those cases. So if you don't have doctors, and then you have the resident doctors who are the key drivers of health activities in the hospital, if they are not there, the effect is really very serious, which is why I think for us, we're happy that there has been some conversation now, at least in the last few days, and when the enemy even they met with the president. And we're hoping now that we now have intervention at the highest level. This should be resolved very soon. In terms of the effect, it's a no-brainer. It's not a good thing for the health system. So, but I think the quicker we get this thing resolved, the better. And so we're hoping that now that it has gotten to the highest level, this is going to be resolved.
This strike is the third strike that NAD will be embarking on since COVID-19 started in Nigeria sometime in February last year. And that's minus other warning strikes. What could be done to at least find a lasting solution to this?
So when we look at this, we need to have constant engagements and trying to be proactive. I think what we'll try to do is even before this thing happens, there are certain things that we need to put in place. When you look at the issues that the doctors are complaining, there are things that are actually been there on the table for a very long time. They're talking about this residency training program in terms of the policy, their adaptation at some states, and then there are some issues they will need to address with the federal government. So I think what we need to do is there should be this constant dialogue between the associations. That's why you have an association. So you have the executives of the association. There should be this very good communication between the Federal Ministry of Health and the associations, so that when they meet, for instance, if, for instance, there's a regular cadence of meeting, let's say even if they meet every quarter or 6 months to look at the state of health in the country every quarter, and then some of those burning issues that needs to be addressed, they'll be able to actually look at them, and then together they'll be able to, they'll make sure that they put in place mechanisms to address them before strikes happen. I think it will be good to have this very good communication between the doctors and the administration.
I wish you could just be more audible. Can't really hear you very well. Yes, but I heard the latter part. So moving on, let me ask the second question. The federal government has said at different times, in fact, the Minister of Health said this just last week, that most doctors only choose to work in Lagos, Rivers, and a few cosmopolitan areas. And while a lot of states, especially those who are largely agrarian and rural, they are abandoned. A lot of doctors do not want to go there. So what are states expected to do to attract more doctors?
You see, this issue of distribution of health workforce is not only just for doctors. It's a very complex issue. And of course, it's not just even doctors. There's tendency that you find out that the urban areas are more favored. People want to work more in the urban areas than the rural areas. There are a lot of factors that will govern choice of where you want to work. For instance, now people look at other variables, availability of some other amenities. For instance, now maybe somebody would like to have an area where you have very good schools, so that that might be a determinant in terms of where you would like to work. So you have a lot of determinants, you have a lot of issues, variables that determines where people would like to work. But inbuilt in the remuneration of doctors, there's what they call rural allowance. That rural allowance is an incentive to be given specifically to people deployed to those difficult areas. And so what the state needs to do, or what government needs to do, is to ensure that those incentives are actually given, and then they're just given to those that are supposed to actually get them. So you have this rural allowance, and then you now give them to cushion the effect of things that you must have missed because you're in the rural areas. And then you also look at, like I said, it's a complex in other social amenities that might be available, because somebody now, he's married, he has kids. He's thinking of the schools that his kids will attend if he goes to a rural area. So, but if you have the school system is also very good, at least someone will not give that excuse to say, no, I don't have a good school, that's why I'm not going to go to that rural area. So they look at those incentive packages and make sure that they deploy those incentive packages, and that will encourage people to actually move to rural areas. I hope I'm still audible. I don't know.
Yes, you are.
Yeah.
About 10 states, as of yesterday, about 10 states have stopped sending reports or updates of their COVID-19 testing to the NCDC dashboard. And there are some states like Kogi, which have not even tested at all. In fact, the number of positive or number of infected people has just been 5 in the last 1 year, which is an indication that testing has more or less stopped. What is the reason for this particular attitude by states, since you interact with them a lot?
Yeah, so I think it's not necessarily correct to say states have stopped testing. People have to come willingly to come for testing. People have to come. I mean, it's a voluntary thing. They are not forcing people to come and test. If people are not coming out to test, then you won't have people to test. So I think it's more of a factor of the community than even the health system. And which is why I think we're hoping that those charged with risk communication will continue to enlighten the public on the importance of coming out to test. A lot of people I think they're fatigued. They don't think they would like to come out to get tested. So if people are not coming out to test, you'll be recording 0 from those states. So I think what we are doing is the emphasis is now on risk communication. NCDC, the states, and all the different pillars that are responsible for risk communication have been working with the different structures at the state level to encourage people to come out to test. So I think maybe what you're also going to help us is use your platform to educate people to come out to test. When they come out, and then we have massive number of people coming out to test, it will give us a very good idea of the the status and what exactly in terms of the status of the pandemic. So we need to continue to encourage people to come out to test. The test is free. The reagents are available, and then you have every state now have a molecular lab that you can be able to do tests. So I think it will be good to continue to encourage the people to come out for the testing. Okay.
If a lot of people are not coming out to test, that means a lot of people will not be coming out to vaccinate. Is that a safe conclusion to make?
No, I don't think so. Because testing is not a prerequisite for you getting vaccinated. So vaccination too is also another thing on its own. So it depends on the level of risks that people attach to COVID. I think the value they attach to that maybe their risk perception level, whether they think they can come down with COVID or not, then they may likely go to take vaccine. But I think the same problem we're having with tests, we have a lot of vaccine hesitancy. You have a lot of conspiracy theories there.
Exactly.
I was reading the other time I think it's in one of the social media. They said the world is not divided into 2. Those that are not vaccinated, waiting for the people that are vaccinated to die, and those that are vaccinated, waiting for those that are not vaccinated to die. So these are just both sides. You have people that have very strong opinions on whether they should vaccinate or not. And I think a lot of misinformation that is going on in the social media is contributing significantly to people not getting vaccinated. But in terms when you see the numbers that are rolled out now, I think we're getting increasing number of people. I think from the last statistics, about 1.6 million fully vaccinated.
Fully vaccinated.
Fully means that means they have taken 2 doses. But if you are talking about 1 dose, I think we are taking in 3 from something million or so that have taken that one. So I think we are moving slow and steady. And this problem is actually not unique to Nigeria. If you look at what some of these countries are doing, I was reading, was it in South Africa yesterday? I was reading on the media. They said they were asking them what is it that they need to do to encourage them to take vaccines. They say give them T-shirts and something. So, and you see even in US, you've seen that there are lots of freebies that the government is trying to give. In fact, there are some that are even given money. They go as extent of going to give out money to encourage. So I guess we have to look at various means that we can do. We have had this challenge before when we were doing polio. When we had polio, people were not coming out to take polio. And I think the country introduced what we call Polio Plus, where apart from the vaccination, they're now given what do you call it? They're given sweets, biscuits, and all this to the kids to encourage them to go. And it helped at that time. And this time around for COVID, which is for adults, what the MPACD is trying to do is what they call a holistic approach. So when you go to a facility, you're not just going to get vaccinated, but you can also get access to other services. So that way, I think hoping that it will encourage people to come and take vaccines.
The federal government, the 1% basic healthcare provision fund is not being released to states because a lot of state governments have not been playing their part as regards counterpart funding. And this has been the same complaint in even UBEC, that's the Universal Basic Education Commission. So why does it seem that as if governors are not taking health seriously since you interact with them so much? Why is there no counterpart funding? Yes.
Sometimes it does the rate at which people, every problem that they have in this country, they just throw it on the head of the governors. And it's not that I'm trying to defend them, but I think we have different roles and responsibilities that the different layer of government is supposed to play. So, but I think all the time, everybody just come out and attack the states. Governors are not doing this, states are not doing this. First, the Basic Health Provision Fund. I don't think it's correct to say that state government are not releasing, they not release counterpart fund. The Basic Health Provision Fund that was released actually was 200 for 2018. The Basic Health Provision Fund for 2019 not released, 2020 not released, 2021 not released by federal government. Although yes, it's a federal government funds that are given to the states, but they have not released it. So the 2018 that was released has been given to all states, and states are now utilizing it. So the challenge now is we need to get, since it is now a law, it is there's an act backing it, that every year you should have 1% of the consolidated revenue of the federal republic, of the federal government is what they call it, is deployed for this BHC provision fund. So that has not been released. So it's completely not true to say that states are not paying, what do you call it, that they're not giving counterpart fund. No, that is not the position, because for 2018, all states, the funds have been disbursed. So we're just waiting for the 2019, 2020 to come, and then that will get disbursed to the states too.
So you're saying most states have actually played their parts as regards counterpart funding?
You see, the story is a bit complex. It's not, I think there were certain other provisions that were made that they asked states to do, which states fulfilled, which was why federal government released that initial, the 2018 funds to all states. So what the two gateways, you have a certain portion of the fund that goes to the insurance gateway. You have a portion that goes to the PHC gateway. So those ones have been released to all the states, and states have they've accessed that fund, and they're using it for activities that they have planned to use the funds for.
Earlier on, when we were discussing vaccine hesitancy, I was going to ask, but it just slipped my mind. This issue of compulsory vaccination now, is it something that is being considered in the governors forum? And personally, do you think it will be effective? I ask this question because some countries have introduced that in a subtle way. In the United States, for instance, the US military has made it compulsory. You know, military, they work with order. It's regimented. That the president ordered that they should all get vaccinated. And over 65%, as at last week, over 65% in the US military had been vaccinated, while about 74% had received at least one form of vaccination. So I wanted to find out from you whether this is something you think, or maybe something that the governors are also considering.
So it's not because it's a national thing. You have the Presidential Steering Committee that has been vested with the responsibility of driving this pandemic response. And what the PSC does is they will look at all the options available to government and then look at the pros and cons before coming up with a decision on whether, for instance, things like compulsory vaccination is something that the country should embark upon. But I think this is something that is still being debated. You have a lot of factors. If there are a lot of things that you need to consider before you say vaccine should be compulsory. So the question now is, if every Nigerian above 18 years now says they want to get vaccinated, do we have the vaccines for everybody? So if you say it's compulsory and then everybody comes out, and then you now say they're not able to access it. So I think there are a lot of things that needs to be considered before they actually say this issue of compulsory. And I think it is actually, it will be more productive, I think, for me, is let's look at some other options that we can be able to actually encourage people. So, okay, people are saying, okay, do you want to force civil servant and say civil servant, you can't enter office? There are certain ones that make sense, that you can say, okay, we know some places like the military now that you say they are regimented. That one makes sense that you want to enforce compulsory vaccination there. But then there are some areas that you know that you have, for instance, in the private sector, in some countries where they say all their workers must get vaccinated before they get into their facility. And the reason is simple. They're trying to protect everybody. They say, okay, if you don't want to get vaccinated, go and work from home. Whenever you make up your mind, you can come back. And so that one also has its consequences. So I guess the PSC, which is the body that is given the power to take some of the decisions, they also have representative of, there is a committee of the PSC that interfaces with the governors. So when you're going to take such a sensitive thing, so they will sit down with the governors before they come out with a solution to say, okay, this is the way we're going to go.
So as we begin to wind down, let me take this discussion a bit towards security. Zamfara State is on total lockdown now as far as communication goes. And also it has, transportation has also been shut down in certain areas. It's also the same in Katsina, where some local governments, there's no communication, and transportation as well as filling stations are shut down. A lot of experts we spoke to believe that this could undermine not just the COVID-19 response, but the health issues in the country, especially those who, for instance, maybe have HIV and might need their medication. What is, from your own point of view, as a health advisor at the NGF, what do you think could be done? At least we know that yes, security is important, but also health is also important. So what do you think could be done in this situation?
This is a very, very direct. We have this issue of security challenges. Somebody has to be alive for him to be able to want to even access care. So I know it's just having that, to have a careful balance between trying to keep people safe and then ensuring that people have access to to the services they require. I think we should learn from some of the interventions that we have done. When we were doing polio, and then we won the vaccines, like in Borno State at that time, where we had very serious security issue, that how do we get people vaccinated in those security compromised areas? What did the government do? Was to actually use the military as part of the team to deliver those services. So now that we have the military now, if you have shut down everywhere, and then but you have the military, so the military have their own, what do you call it, their health unit. We could be able to leverage on them, on the health unit of the military, to be able to deploy some of these services, for instance, either vaccination or even given access. So in this regard, I think our best bet is collaborating with the military to get these services delivered.
Right. And of course, issue of cholera is also plaguing the health sector now.
Yeah.
I'm not even following up again with the death toll right now because it's just happening. It keeps changing every day now. But cholera is not even new. Nigeria has been having periodic effects. Periodic outbreaks of cholera in the last, say, 7 years. But currently, we're told now that cholera is being fueled by, has been named the capital of worldwide open defecation. So isn't this an indictment on the states? Because facilities like, what's it called? Latrine, public facilities and all that should actually be under the states, if I'm not mistaken.
Yeah, so you see, I think these issues, it's a shame that we're still having at this age, we're still dealing with cholera. But when you look at cholera, it's more of socio-economic than even medical issue. What I'm saying in this regard, when you say, okay, provision of water, you just talked about open defecation now. This one is people that needs to make sure that what do you call it, that shouldn't defecate anyhow. So it's people that needs to take responsibility. Yes, I agree that there are certain things that government needs to provide. Yes, we can have public facilities, but people also have what do you call it, in their homes. Maybe some houses don't have what do you call it? Some houses don't have public. They don't have what do you call it? Toilet, but they don't have toilet facilities. But there is a way that they could actually dispose those feces responsibly. I mean, in terms of how what do you call it? They manage those their feces. So for me, the responsibility is both sides.
What of access to water? Access to water as well.
Yeah, so yes. Water. So it's when you look at the whole story now, you have people defecating openly, then maybe rain comes, washes all those feces. Some of those feces are infected, and then people, because they don't have water, they drink those water, and then they come down with cholera and all those things. So yes, so apart from sanitation, issue of access to water, that's something that also needs to be addressed. But generally, when you're talking of epidemics, I think we should look at it. What we're saying is, let's look at it more holistically. I mean, in terms of the comprehensive nature, the parts that health needs to strengthen, because those ones of having water, sanitation is outside health. But for health sector itself, it needs to have a comprehensive approach to health security, whereby we have very strong surveillance system in place, that when we start having people that are coming up with symptoms that looks like cholera, we'll be able to quickly detect it and put in measures that will be able to address it. So it shouldn't come to the case that now we're now having over 60,000 cases of cholera, and then we're going. But when you have a very strong surveillance system and you have a very good laboratory network that is able to quickly detect, to say, this diarrhea that you have seen is actually cholera. So you'll be able to put in place appropriate measures. And you need to have the personnel that you can be able to deploy to do those responses. So that's the health component that I'm saying what we need to do for us in the health sector. And this is the push now to make sure that in each state you have what we call epidemiological units that are responsible for this kind of activities. So it's to strengthen them. And I think that's what the different states. I think there is, which state was it now that they came that I think there is even one of these organizations came to say, okay, we should commend that state. They released about 300 million to strengthen their AP unit. So you have different states doing one or other to strengthen their AP unit to make sure that those what the health sector is supposed to do, they do it. But then we need to collaborate. Things like cholera. You have some other, a lot of diseases are not just restricted. I mean, in terms of addressing them, it's not just the health sector. You have to have other sectors. You have to collaborate with other sectors. So collaborate with water, environment, and all the other sectors to work together to be able to address it. But honestly, I think it is, yeah, it's a shame that we are still having cholera at this stage.
Thank you very much, Doctor. We've been speaking with Dr. Ahmad Abdul Wahab, the Senior Health Advisor at the Nigeria Governors Forum. He's been talking to us about the effect of the doctor strike on the health system, on the health sector, on cholera, and as well as COVID-19. Of course, as I said earlier, this entire conversation has been recorded and it's on our Facebook page. You can visit, watch again, share, and like. Thank you so much, Dr. Abdul Wahab, for joining us this Wednesday.
Okay, thank you very much. I think it's a pleasure that we've been here, and I think we have the public. We have our own website too. If you want to, I think you can always you can always visit our own website. I mean the NGF website.
Okay, what's the website?
Our website is what? www.ngf. Yes, I'm just trying to get that one now.
Okay.
It's ngfgovernorsforum.org.
ngfgovernorsforum.org.
Yes.
All
and
right.
Then you also have it is a Twitter handle that you have at NGF Secretary.
I hope your Twitter handle is active. This one that government has.
We actually have a social media person.
Okay.
We have a social media person that is actually ensuring that these days of social media, we also try to get information on social media. So Instagram, Facebook, all those. So we're also trying to keep up. So
all right.
Get all this information on those handles. So
we'll do that.
Whether you go on our website, you go to our Facebook page or Instagram, you get all this information.
Thank you very much, Dr. Abdul Wahab. My name is Eniola Akinfotu. Thank you for joining us this Wednesday afternoon.
Thank you, Eniola.
Goodbye.
Thank you. Bye-bye.